I want to discuss a topic that is both very simple and at the same time profoundly deep. It's about how the smallest elements in your life, your sleep, your mental stress, your timing, your diet, and even your thoughts, silently join hands to change the trajectory of your health, leading to a slip into illness. The journey from health to disease doesn't happen overnight. It begins as a silent deviation. More importantly, we will explore how proper lifestyle corrections, when done with the accurate knowledge and clinical support, can shift the trajectory, reverse the direction, and restore your health. This is not a complex science class. This is a fundamental truth that every individual, every family, every patient, and every caregiver must understand. Our body doesn't fall ill suddenly. BP, high blood pressure, type 2 diabetes, thyroid variations, fatty liver, knee pain, acidity, insomnia, excessive belly fat, constant fatigue. These are not conditions that develop in 2 days, 2 weeks, or 2 months. They are the continuation of a story that has been developed silently for years. It's only in the final chapters that they lead to heart attack, strokes, autoimmune diseases, and cancer. The truth is, long before a diagnosis is written on your paper, your body was whispering, giving you warnings, but we fail to notice. The reason for many diseases and catastrophes is that most people don't know how to listen to and understand the body's language. These whispers, no one teaches you, nor you learn by yourself. Your own body's communication format, the language. Today, 90% of patients seeking treatment in hospitals are doing so for lifestyle disease. Do you know which diseases falls into this category? Diabetes, hypertension, blood vessel blockages, heart disease, stroke, heart attacks, various types of cancers, allergies, asthma, rheumatism and arthritis, kidney, liver, and digestive diseases, skin diseases, and autoimmune diseases like SLE, vasculopathy affecting blood vessels, neuropathy affecting nerves, hormonal issues, and mental health disorders, obesity and infertility all fall under lifestyle diseases. Every patient and their relatives must understand this reality. The root cause of most of these diseases treated with medication and surgery is lifestyle. Only then can the right treatment and recovery be achieved. Modern study shows that even pregnancy complications, premature birth, birth defects in children, and mental issues like autism are linked to the parents' lifestyle. The first major problem is this: the early sign of declining health and disease will not show up in the standard test reports. The routine reports may be normal. The numbers may look absolutely fine, but the body will already be showing symptoms and asking for help. You wake up with a headache. You feel a numbness in your body. Your mind feels dull. Acidity follows a meal. You feel bloated even after eating liquid. You feel angry or sad for no reason. You call the fatigue that hits in the afternoon a post-lunch slump. At night, your sleep isn't deep. You wake up frequently, or you feel unrested when you wake up in the morning. All these are dismissed as small problems, aging, or stress. Yet the body is clearly saying one thing: my rhythm is broken. I am slowly moving in the wrong direction towards disease. The body's language is not just the lab report. The body's biggest language is your experience, the symptom it shows. If your life doesn't feel normal, even though the reports are normal, the problem won't necessarily be reflected on a routine lab report. It needs more deeper investigation. The issue is that even your own family and doctors may not be ready to believe you when you say you feel unwell because the standard tests are normal. Patients often tell me, Doctor, the reports are fine, but I have fatigue and discomfort. You know, you are not well. That is the truth. But often doctors suggest it might be psychological, sometimes referring them to a psychiatrist. There are medications to reduce blood pressure, sugar, and cholesterol. Therefore, only such tests are usually done. Many tests are available today to detect liver disease like fatty liver and fibrosis, kidney diseases, blood vessel blockages, and cancer early on. But even if detected early to test, this cannot be cured by medicine. Therefore, although markers and tests are available to detect blockages and cancer early, doctors usually don't recommend them because there are no immediate medication for these conditions. Moreover, many such tests are expensive and not covered by insurance. The doctor does not have the medicine for these diseases caused by lifestyle deficiencies. The real medicine is to find and correct the lifestyle flaws. The patient must acquire the necessary knowledge and capacity to do this themselves. Today, for many diseases, treatment begins only after the disease has advanced to a certain level. For example, when blood vessels are almost completely blocked, leading to a heart attack or stroke, doctors insert stent or perform bypass surgery. When the kidneys and liver are destroyed, doctors perform dialysis, kidney transplant, and liver transplants. When the cancer grows into tumors visible on scan and positive on biopsy, the doctors resort to organ removal surgery, radiation, and chemotherapy. Today's reality is that the disease and the patient become ready for treatment only at this advanced stage. In the case of a stroke or heart attack, the first hour is the golden time. If the patient reaches a super specialty hospital with all facilities quickly, the mortality rate can be reduced and recovery chances increased through medicine or surgery. However, your body is always telling you the truth from the beginning through small discomforts and symptoms. By ignoring this, you miss the real golden opportunity, the most valuable golden time to restore. Then, when the complete blockage leads to a heart attack or stroke, the drive to the hospital becomes the golden hour. This means that finally, when the disease advances, patient and relatives are willing to accept risky, often ineffective, expensive, and uninsured tests, medications, surgeries, and radiations just to keep the patient alive, even with a compromised quality of life. This situation must change. If we recognize the deviation in health direction upon noticing minor discomforts and are willing to correct the lifestyle, most premature death due to attacks, strokes, and cancer can be avoided. Whatever the disease, we experience five main symptoms: fatigue, fever, pain, redness, or tumor. These symptoms are caused by chemicals produced by the action of the immune. Through these symptoms, the immune system seeks our attention and asks for help to eliminate the infectious agent and toxin causing the disease. Most medications, given to reduce pain and discomfort, work by inhibiting or numbing the immune system, thereby reducing the symptoms. The immune system can function optimally and health can be restored easily if we provide the necessary nutrients to produce more white blood cells and antibodies to destroy the pathogens and toxins, and to replace damaged cells with new healthy cells. The cause of disease and the lack of recovery often lies in the imbalance of omega 3 and 6 fat and regulate immunity and the rhythmic failures in the immune system due to nutritional deficiencies and toxins. We need to resolve these immune imbalances by providing optimal level of nutrients and exercise and by helping the body reduce toxicity. Excess fat accumulated in the body act like a toxin. Fat is an endocrine gland. Obesity and belly fat should be viewed as an overgrowing endocrine gland, like a tumor. We must recognize and try to avoid the risk posed by excess fat accumulation early on. Acute inflammation caused by an injury is part of the defense mechanism. It aids recovery. However, due to your lifestyle errors, the toxins accumulating in your body cause a small fire of defense to constantly burn within you. That is chronic inflammation. Scientifically, almost all lifestyle diseases like diabetes, hypertension, heart disease, arthritis, and cancer fall under the category of inflammatory disorders. Do you know what this fire of inflammation does to your body? It damages blood vessels. This inflammation damages blood vessels, leading to retinopathy, nephropathy, neuropathy, memory loss, tingling, numbness, and burning sensation in the hands and feet. Next is joint pain. The same inflammation accumulates in the joints, causing arthritis and joint pain. Next, heart problems. This inflammation causes fat to deposit in the blood vessels, leading to high blood pressure, blockages, and heart attacks. Next is cancer. This inflammation is also what damages the DNA within cells, causing mutations that lead to cancer. Medications might temporarily suppress this chronic inflammation, but they cannot change it. The immune system views medicine as a toxin. Long-term use of medication adversely affect all organs, especially the immune system, liver, kidney, blood vessels, stomach, and the skin. Now, how does this lifestyle deviation begins? In most people, the first thing that goes wrong is sleep. Late night, irregular sleep, excessive screen use, emotional stress, anxiety. This slowly starts to steal the body's repair time. Sleep is not just rest, it is the time for cellular repair. When sleep is reduced, interrupted, or delayed daily, the body doesn't get proper repair time. You wake up unrefreshed. That is chapter one. Next, your appetite rhythm is broken. The body has an internal clock that dictates when it needs food and when it needs rest. But irregular routines, frequent snacking, midnight meals, stress eating, and sugar cravings all confuse the body's clock. You feel hungry at the wrong time, eat at the wrong time, feel heaviness in the stomach, feel sleepy at the wrong time. Slowly, acidity, gas, bloating, and food related discomfort start increasing. That is chapter 2. Then your stress chemistry changes. Overthinking, work pressure, financial worries, family tensions, unresolved emotional wounds all keep your stress hormones high. When stress hormones remain elevated for too long, they disrupt digestion, increase acidity, alter heart rate, and blood pressure patterns, further interrupt sleep, and create a background of irritability and inner restlessness. You start to feel like you are always running. Even when sitting, you are running inside. That is chapter 3. With the disruption of eating and sleeping times, the functioning of the liver, the body's main production factory, begins to go wrong. Skipping breakfast, having dinner very late, eating too quickly, overeating during stress, frequent snacking, and heavy late night meals all place enormous strain on the liver. Very slowly, silently, and painlessly, fatty liver begins to die. Fatty liver is not just a liver problem, it's a signal that the entire body is overloaded. It is the body's humble way of saying your rhythm is broken and you are eating more than you use and storing the rest. Fatty liver and belly fat are not the beginning of your problem. They are just a visible sign of years of rhythmic failure. As the lifestyle deviation continues, every organ begins its silent struggle. The liver is strained first, digestion slows down, sleep is further disturbed, blood sugar levels start fluctuating, sometimes high, sometimes low. Blood pressure begins to shift. The stomach becomes uneasy, gassy, and tight. Breathing becomes heavy upon exertion. You gasp. The mind slows down, becomes foggy or anxious. Finally, when the organs can no longer compensate for the damage, the report begins to change. That is when a label is placed on you. You have BP, you have diabetes, you have hypothyroidism, you have grade 2 fatty liver, you need a stent, you need bypass, ANA positive, SLE, need a biopsy to cure cancer. That is when you start paying attention. But by then, the body has suffered silently for long years. We miss this entire collapse because it is slow and silent. If the body screamed on the first day, everyone would immediately change their habits. But the body is gentle. It tries to adapt, it adjusts, manages, and attempts to repair damage. But repair work fails due to a lack of nutrients. We only notice the taste of food, not its nutritional value. Artificial flavors, colors, and preservatives increase the toxin load. The test only allows the numbers to go wrong when the body can no longer bear the load. Therefore, our biggest mistake is we recognize the disease late. We ignore the initial discomfort. A routine report delay the truth. The body speaks the truth early, but we ignore it. Another crucial truth we must accept is the reality that treatments, medicine and surgery have limits. Medicines are powerful, but they have limitations. Medicines can control BP, reduce sugar, fix acidity, reduce pain, help the thyroid, control inflammation, and save your life in an emergency. Antibiotics kill germs and vaccination prevent disease. They are essential and should not be dismissed. But medicines cannot change the direction of your lifestyle. They help correct test reports. They are not a substitute for daily nutrients, exercise, and sleep. They do not repair the body. Remember, medicines help you face the current crisis, but your lifestyle decides your future and the course of your health. Why do many people fail when they try to change their lifestyle on their own? They start a diet, switch rice to wheat or millet, try keto, intermittent fasting, or fruit only days, all without understanding their sleep pattern, stress load, digestive capacity, liver status, or hormonal rhythm. The result, fasting increases stress, late night dinners continues, the phone still comes to bed, worries persist, the liver still struggles. After a few days, body press, they feel fatigue, discomfort, or burnout, and they conclude, lifestyle change doesn't work for me. The truth is that method was not suitable for your body signs. Some patients take various medications for long periods. Long-term use for arthritis increases gastritis, liver and kidney strain. They never realize that poor sleep, stress, and diet increase joint inflammation. Some people are advised to get another stent for heart symptoms. They fail to understand that the blockages are not due to lack of stent, but due to mental stress and lifestyle. Some suffer from diabetes, kidney issues, and fatty liver simultaneously, are told to manage all three separately, but never correct the underlying lifestyle rhythm. Women with the thyroid issues or PCOD continue medication, but their sleep reduces, stress increases, and weight rise. Digestive and menstrual problems increase. Patient with autoimmune diseases like psoriasis use medication for years, unaware that internal inflammation, gut health, and lifestyle are the main cause. The disease confined to the skin gradually affect the joints as arthritis, and side effects from steroids cause diabetes and high blood pressure. Thus, both the disease and the number of medications increase. This is the flaw in modern healthcare. We manage the disease, but we fail to understand the root cause, the lifestyle. We adjust medication doses, but the patient misses out on the knowledge and support needed to find and fix the lifestyle flaws. That is the importance of clinically supported lifestyle correction. What is clinically supervised and supported lifestyle correction? It has three steps. One, assessment. The first step is to assess body's composition and fat percentage and determine the optimal body composition goal. Two, diagnostic. The second step is blood test to assess the health status of organs, heart, blood vessels, liver, kidney, etc. Immune status, hormone and nutrient levels, and to understand the specific food that suit or do not suit the body. Three, correction plan. The third step is the lifestyle correction plan. It focuses on providing optimal nutrition and activity pattern tailored to the patient, along with reducing the body's toxin load. The aim is to restore and maintain the balance of metabolic process, chemical activity vital for life, by creating an optimal environment for body cells to function. It is observed that for most patients suffering from diseases like diabetes, pressure, heart disease, allergy, arthritis, cancer, who have been on medication for years, most medications can be reduced and or even stopped, and surgery is avoided within a month, provided they commit to the lifestyle correction before the organs are completely destroyed. Next, let us look at the scientific basis of this treatment. Clinically supported lifestyle correction focuses on empowering immunity, the body's self healing power, which is fundamental to disease prevention and recovery. We focus on three things to rebuild the body with new healthy cells. One, nutrition, ensuring the body receives all the necessary nutrients in optimal amount and ratios for cell reconstruction. Exercise and circulation. Through gentle, segmental, and optimal activity planning, we stimulate all cells, increase blood flow, and help to flush out accumulated toxins. Three, toxin reduction. We reduce the toxin entering the body through food, water, air, cosmetics, and medicines. I have focused on lifestyle correction in my practice for years. Patients who come to me are often those whose disease having been cured by modern medicine or Ayurveda, Homeo, or Unani, etc., or who wish to avoid constant medication, and those who want to avoid surgery. I follow the clinically supported lifestyle correction protocol that I have developed myself. I usually see that those on multiple medications can reduce and stop most medication within a month, and many are able to avoid surgeries. To get a clear picture for you, we will check clinical data of a few patients undergone clinically supported lifestyle correction with this protocol. First, we will see a patient who has come after an angioplasty. He had an attack and he has undergone a primary angiogram and angioplasty and put two stents inserted. And he came to me on the 8th day. Actually, he was worried of a repeat attack, and that is why he wanted to start the lifestyle correction at the earliest. He was also suffering from diabetes, hypertension, and also high uric acid levels. And kidney function also was low. And he had some gastric issues also. And on examination, on this report showed that He has deficiency in many items like folic acid, folate, and iron was very low, and vitamin D was low. And the most importantly, the troponin level was so high, 386. Even after 1 week after the uh, this angioplasty, his troponin was very high, and also his GFR is only 41. And with this, maybe because of this dye injected along with the, for the angiogram, uh, that is causing the kidney damage also. And microalbumin, that is urine is passing uh, albumin in the urine also. And his inflammation levels are very high. ESR, HSCRP, CRP was very high. And also his bilirubin level was also high. It is shows some damage to the liver also. And in the ultrasound scan, there is fatty liver grade 2 also is there. And basically, he's having a kidney disease stage 3 and fatty liver disease grade 2 liver disease also is there. And the medicines he was taking, and actually he was taking this blood thinners was there, recospirin and answer was there, and also the anti-acidity medicine which has to be taken along with it. That is there. And very high dose of atorvastatin was 80 milligram he was taking, and also BP medicine, two or three BP medicines, and also ibutostat for this uric acid, and diabetic medicine and insulin he was taking. But his result shows that he is already having type 2 diabetes. So when we are doing this clinically supported lifestyle correction, if it is a type 2 diabetes, we can stop all the diabetic medicine. And because we don't have to worry, we can check the sugar level. Because we have diabetes medicine is stopped, we are taking diabetes medicine only for sugar control. So we'll be checking, and he's able to, even after stopping all the diabetes medicine, is able to come to normal blood sugar level within 12 hours itself. Yes, usually most of the patient who are looking correctly, they'll be able to come down 12 hours or maximum 48 hours. They will be able to control the blood sugar. But even next is, what about the troponin level? Troponin level actually it came down on the eighth day itself, came down from 386 to 29. And then by the 15th day, it came down to normal 10. After that, every visit, his troponin level was keeping normal. Then what about the HbA1c? We have stopped all the insulin and diabetic medicine. Actually, without the diabetic medicine, after stopping the diabetic medicine, when he was starting, its HbA1c was 7.1. With all this years from strict diet also, after Vanata, he's also frightened. So after stopping it, actually within a week itself, HbA1c came down to 6.7. And finally, by the day the 90 days, 3 months, his HbA1c was 5.5. So absolutely under control. Even by the 60th day itself, it just came down to 5.8. So, and what about the renal function? Renal function, it was only 41 when the initially, and the GFR came up to 74 in the 8th day and 85 on the 15th day, and by the 30th day, it is completely normal. So that is the change. When you give proper nutrition and proper exercise for improving the circulation, you get very fast result. And you can come out of this, is able to come out of all the medicines within the first month itself, except this blood thinners, that is ecosprin and so, and the anti-acidity medicine to compensate for this medication. We will see one more heart patient. This patient came to me before actually angioplasty or bypass surgery. He had an attack and he was undergone a angiogram, and they found that there is two vessel diseases there. And advised, I don't know why they were not able to do the angioplasty as a primary angioplasty, but he was advised on another sitting for an angioplasty. And he's also having a bundle branch block, that is, his heart rate is slowing down, and his left ventricular function, this pumping, was reduced to 35%. So there's a great amount of cardiac failure also is there. That may be the reason they immediately, as a first sitting, they're not able to do the angioplasty. So he has advised that he may need a future may need a pacemaker also because of this heart rate is lowering and bundle branch block is there. And along with that, he was having other diseases mainly of hypertension and chronic kidney disease stage 3, and he's having varicose veins also, stage 4 varicose veins also. When we looked into his blood reports, actually he's not diabetic. Usually most of the cardiac patients are diabetic, but he was not having any diabetes. And his cholesterol was low, 165 only. He's also taking many medications for the cholesterol and the BP. He was not a hypertensive patient before, but after this he was given some antihypertensive medicines also. He's also given this aspirin and clopidogrel and atorvastatin and all. His blood thinners he was given. The other blood parameters which was high is mainly GFR was reduced to 54 and other HSCRP and homocysteine, the cardiac markers was also increased. Next, what was the result after starting clinically supported lifestyle correction? He wanted to avoid the stenting itself. His troponin level was actually normal. He didn't have much of an attack actually, or maybe by the time it was been cleared. So within a week, when he came, actually he was able to come out of all the medication. This hypertensive medication, he was able to come out by the second week itself, and by the third week, by the 30th day, the aspirin also was reduced, and by the 60th day, all the medicines were stopped. And what was the blood reports actually? His major concern was, another concern when he is coming, was creatine level was high, and also GFR. Actually, his GFR increased to 69 by the 60th day and 73 by the 90th day. He's not able to recover fully, maybe because of this blocks, which is one of the reason, and he was having some RBCs in the urine also. Maybe he is having an underlying IgA nephropathy or something like that. That may be the reason. And also AMA. He was not a thyroid patient. His thyroid function is normal, but the autoimmune antibodies, AMA was also high. So the advantage for this patient is actually he is able to come out of all the medication within a month. That is because you not put the stent. If the stent was put, you had to continue the blood thinners at least for an year. And what was he was having this pumping was low, and left ventricular ejection fraction was only 35%. So usually we check the left ventricle, this echocardiography after 3 months. But we are so anxious to know what is the result. So we did the this echocardiography after 60 days itself, and it was came up 52.5. So it is increased within 2 months itself. That shows that his pumping also increased. But definitely it shows the clearing up of his blood vessels. Otherwise, it cannot happen like that. So that from these two heart patients, what we should understand that if you are able to start your lifestyle correction before stenting, you can, or if you're after 1 year after this stent is placed, you can come out of almost all the medications and hypertension, diabetes, and such things also. Along with that, it will be cleared, and the person will be able to reduce if excess fat is there or excess weight is there. Usually within 3 months, you will be able to reduce around 20% weight also. So that will take care of almost all the organs, and your body's aging also will be reduced. So if most of the patients will be having accelerated aging, so it is a sort of this this clinically supported lifestyle correction is a sort of anti-aging treatment also. Next, we'll see a person with stress and depression and panic attack and on antipsychotic medication. Her other problem was obesity and tiredness. She's she's very young, only 33 years. She's working is in very good position actually. It's an office post she's working, and very responsible job position she's holding. But her problem is depression. She was taking many medicines, Nexito, Franksit and Vernice, 3 medicines she has taken. Maybe because of that, she is feeling very tired. Because all the psychiatric medicines will be suppressing the brain. So it can, that is one of the side effect of it. And also she is very much obese. Her height is only 156 centimeter and her weight is 71 kg. So then what was the result after starting this clinically supported lifestyle correction? After the first week, 8th day review itself, she said that she is having marked improvement in the energy level. And also, we started reducing the dosage of the antipsychotic medicine. And by the 15th day, it was reduced to around half the dose. And after the 15th day, she has started going for job also. By 30th day, when she came, she was out of all the medication. So very fast, she was able to come out of the medication. And by the first month itself, she was actually able to reduce her weight also substantially. And by 1 month, she was at 2 months, she was able to come down the weight to 63 kg. So that is the importance of this. So in the psychiatric patient, especially if they are obese, this reducing the fat level in the body also is very important. And the brain is basically made of fat. So with the modern diet, the brain may be containing more of saturated fat and hydrogenated fat or even the trans fat. This is also is major problem with this nerve conduction and messaging, sending and all. So what we are trying is to replace the correct bad fat with the ideal omega-3, 6 and 9. But omega-3 is the most deficient and the most important for the brain. So that may be the reason, because we are giving a very high omega-3 diet which was we were able to give her, and it was very fast to recovery also. And by the 3 months, she was finally, even after 1 month itself, she started working and she is not complained. Before that, she was actually planning to resign. The parent and the husband brought her because she's continuously pestering them that she's going to resign from the job because it is very good job and they want to continue by somehow. Because if you're sitting at home, it will be more worsening also will be there. So anyway, she's very fine. By the 3 months, she's absolutely happy without any medicines. Another most important thing is her body age. Actually, she was only 33, but her body age was 53. 20 years accelerated aging was there. And by the 2 months, she was able to come down to 63 kg and her body age came down to 47. So within 2 months, she's able to 6 years she can come down. And by the 90th day, she was able to come down 3 kg and her body age also came down to 45. But she has to go more distance to cover and she has to come ideally to at least around 55 kg. Next, we will see a patient with rheumatoid arthritis and Hashimoto's thyroiditis and psychiatric problem and also varicose vein. All this actually is troubling her and also frequent migraine. This is a 39-year-old lady, 166 centimeter height and 80 kg. She's overweight, obese also. She's taking for the last 15 years this antipsychotic medicine and all these medicines for a long time. That is the reason for his overweight, her overweight also. And fibromyalgia, all minor things I'm not getting into it. And she was taking medication, 3 medicines for arthritis, leflunomide, that is leflunomide, and methylprednisolone, and igateramol. And also this Nexito and lithosin, very high dose, 400 milligram BD for the psychiatric. And then this thyroid medicine and many supplementary food supplements and also this anti-acidity medicines also. So then what was the result? She was also working in a very responsible position. She's a postgraduate in engineering and working in the defense associated as a scientist in the defense industry. So these diseases are troubling her a lot. And then when we looked into the blood parameters, usually psychiatric problems will not show much of the blood parameters deviation will not be there. And mainly she was deficient of vitamin D and some other nutrients, and also her HLA-B27 was positive. She has a genetic predisposition for this rheumatoid arthritis. And the cholesterol and lipid profile was very high. And that is very usual to those who are on psychiatric medicine. And what was the result? Actually, in the psychiatric medicine and also the rheumatoid medicines, we tapering off very slowly also. And in this patient, we are able to taper off almost all the initially itself reduced dose, and by the day 90, almost all the medicines has stopped. And only occasionally she goes for a cheat day and taking some food outside which is intolerant for her. She may have to take this medication for the anti-inflammatory for that day, one day or 2 days. And thyroxine, she was taking 88 milligram, that she was able to bring down to 25 milligram. And by the 60th day, that thyroxine also, she was not 68, by the 180 days, 6 months, she was able to come out of all the medicines. And what was the body composition? She was very obese. What was the body composition? Actually, she started with the 80, and she was actually not close by there. She was working in another state. So she didn't have a frequent visit. So body composition analysis was done by the by the 270 day. She was 80 kg. She came down to 55 kg. So it was a very good result. Almost 25 kg she was able to come down. And when we started her treatment, her body, real age was 39, but her body age is 58. And she was able to come down to 40. By the time almost her birthday was also over, by the time she was 40 years, and her body age also came down. Almost 18 years she's come down. So that reflect in all her activities and quality of life and energy level and all will be showing that also. Her body fat level was 39.3 when we started, and it came down to 29. And visceral fat when we started 11 and came down to 25. So that is the result. So this patient has multiple diseases. And even this varicose vein was a major problem for her. She can not able to stand for a long time. So that also is reduced. Varicose veins will not go completely. That varicosity will be remaining, but that vessel will start shrinking also. So size will be reduced and the discomfort will be gone. Next, we will see a patient who was advised to do knee replacement surgery. He was suffering with the knee pain for a long time, and his knee is deformed. It's a varus deformity was there, and now only option is bilateral knee replacement. Along with that, she was suffering from chronic kidney disease and hypertension and dyslipidemia also. So then what was the result? We'll see. She was not on much medicines, even though only light medicines for hypertension and low dose for 5 milligram atorvastatin only. So what was the result? So basically, within the 8th day itself, when she came, she was telling her pain has reduced. By the 15th day, even with this deformity and all, she's saying that she's much comfortable. There is no difficulty in getting out of the car. So that is and she's telling her driver also has noticed that now you are improved. Really improvement is there. And she was really limping in the initial stage. But by the 90th day, she was 66-year-old and her height was 151 centimeter and weight 60 kg. By the 90th day, she was able to come down to 49 kg. It's a very good result. And by the 150th day, that is 5 months, she came down to 47. So by the 5 months itself, actually, 6th month, she didn't come for a review also because she's very comfortable and every homely activities and she's able to manage and without pain. That was the result. So, I mean, I had seen many patients with advised this knee replacement surgery. And all were able to. Only thing, if they're able to follow the diet, and also weight reduction also is very important. And usually we see that this cartilage won't grow, but it is not correct. In my experience, if you give correct nutrition and correct exercise, and weight bearing should be avoided. They cannot do exercise by running and walking or anything. These patients can do only the core exercise they can do, lying down or sitting in. That is the routine we are giving. In that, we will be able to come out of this, and the cartilage also will be regrown. That is why the pain, and they are able to manage. So everyone should think of, if you are advised to go for a knee replacement or any other this joint surgeries, there is lifestyle correction is the first option you should always think of. Next is a cancer patient. This patient come to me after her surgery for the rectal carcinoma, and it was she was actually suffering from other diseases also, like diabetes, hypertension, and dyslipidemia for many years, and she was on medication. So she wanted to avoid recurrence. This patient, her family members, daughter and uh, the son-in-law, both was a patient here for different reasons, and that is why they brought her after this cancer surgery for avoiding recurrence, and also to uh, come out of diabetic and hypertension and dyslipidemia medications. So, what was the result? Actually, she was able to come out of all the medications by the 30th day, diabetes, hypertension, and her initial HbA1c was, with the medicines, it was 6.7. She was under real control actually. By the 90th day, her HbA1c came down to 5.3, and the BP, perfectly normal BP, and almost other some blood parameters, like she was fatty liver was there, and her SGOT, SGPT was slightly increased. But by the 30th day itself, her liver function test was come down to normal, and by the 90th day, they had done to see what is the result of the fatty liver. And initially, she had two fatty liver, and it was come down to grade 1 by the 90th day. So, if by the 60th day, if she continue and the weight reduction, along with that, the fatty liver also goes, and that is a routine. Usually, by the one level, it will be reduced, and then further, when we are continuing, the further fat reduction from the liver also will be possible. It's highly encouraging that patients across many categories benefit from scientific lifestyle correction. They gain relief from long-standing discomfort, medications, and the need for potential surgeries. It gives them renewed hope. Some patients are those who couldn't find relief despite years of medication and multiple surgeries. Others come seeking to avoid operations for heart, like angiogram, bypass, pacemaker, etc. Arthritis, joint replacement, surgeries for thyroid, uterus, varicose veins, miles, hernia, etc. Some come immediately after the diagnosis, like diabetes, hypertension, SLE, etc., before starting medication. Others come without any disease, just to reduce obesity, regain body shape, and improve beauty and health. Couples come for pregnancy planning, support to ensure the baby's health, and those facing infertility issues also arrive. Additionally, those seeking to avoid recurrence of cancer treatment, those in cancer palliative care, and those looking to prevent recurrence after heart attack and stroke. Many people facing and wishing to avoid various health issues benefit from scientific lifestyle correction. The easy way to treat lifestyle disease is to correct the lifestyle. Diabetes, hypertension, heart disease, stroke, allergies, autoimmune diseases, and cancer fall under the category of lifestyle diseases. Today, approximately 90% of the medicines and 90% of the surgeries used globally are for such diseases. This means 90% of the medicines and surgeries could potentially be avoided. Lifestyle disease cannot be cured by medicine or surgery, because the basic cause of this disease is not the lack of medicine or operation. That is why once medication is started, it often needs to be continued continuously. Consider a seed, a mung seed, and how fast it sprouts. When you give it water, sunlight, and protect the soil, how quickly it grows. The body also has seed cells, stem cells. If you provide the necessary correct nutrient and blood flow, these stem cells can rebuild your body by replacing damaged cells with new healthy cells. We must utilize this potential of the body for recovery. Lifestyle correction is not about forcing the body, it's about supporting. It's not about intimidating you into change, but about understanding and deciding if changes is needed. When you understand what your body truly needs, you naturally start cooperating. That is why we use this term self science, the science of understanding your own body. It's not self help, nor is it self blame, but self science, understanding what your body is asking for, where it is struggling, how far the deviation has gone, and how much repair is possible. When you see the complete picture of your life, your sleep, your food, your stress, your actions, your tests, and the symptoms your body shows, all on a single map, something within you will change. That clarity itself is medicine. This is the biggest fear people have. Will I be able to follow this? The answer is simple. You don't have to do everything perfectly. If you walk halfway, your body will walk the other. Your body is not your enemy. Once you give it the right direction, it has an extraordinary ability to cooperate. But it needs guidance. It needs a plan that is scientific, realistic, and tailored to your life. That is where clinical support becomes essential. The first step is not a diet chart or an exercise schedule. The first step is a clear and honest assessment of where you stand today. In a structured assessment, we need to understand your lifestyle pattern, organ health, digestion, sleep, immune status, mental stress, liver condition, kidney parameters, hormone profile, and the timeline of your symptoms. Not as scattered points, but as one single story, the story of your body. When you see that story in front of you, clearly explained and on paper, you naturally begin to understand what you can do for your own body. Once you understand your body's problems, lifestyle change won't feel like a punishment. It will feel like pride and increase your confidence. That is the essence of self science for healing. You realize that only you are there to support your body. You realize that only you are there to help the 50 to 70 trillion cells in your body. If after hearing this, you feel what I call more problems, small at all, or my reports don't match what my body is telling me, or I want freedom from the medicines I take daily, or I want to enjoy health freedom, then your next step is very clear. Another important aspect is when someone is talking about healthcare and your treatment approaches, you should consider the scientific background of the concerned person. I'm Dr. Jolly Thomson, started medical education in Government Medical College, Kochi as 1981 batch, and completed diploma and MD in obstetrics and gynecology from Government Medical College, Thiruvananthapuram, Kerala, India in 1992. After additional training in reproductive medicine, surgery, and painless labor, I joined government service. Later, I resigned from the government service and in 1997 started practicing as consultant Life Care Center, Devara, Kochi. I focus on lifestyle modulation with clinical support, minimizing medication and surgical interventions for lifestyle diseases. One more important thing everyone must understand, the medicines we consume eventually reach rivers, drinking water, plants, and food products as waste material from patients' urine and stool. This means that medicines consumed by every individual patient threaten all living beings and the earth ecosystem. Therefore, finding and resolving the lifestyle flaws that are the root cause of lifestyle diseases and gaining freedom from medication is not just essential for this generation, but also to protect future generations from the scourge of chemical pollution. The practice of taking medicine lifelong for lifestyle diseases must change. Awareness about the need for freedom from medication should be created in everyone. Therefore, remember to share this video with your dear ones, those taking medications and or preparing for surgery for lifestyle disease. For more health videos, click the subscribe button and the bell icon. The solution for lifestyle diseases is not medicine or surgery. It is correcting the underlying lifestyle flaws. More information on different lifestyle diseases, various modern medical treatment methods, their pros and cons, and clinically supported lifestyle correction is available on website and in other videos on this channel. Links are given as pinned comments. The real medicine for lifestyle diseases is lifestyle correction. To gain recovery and live a healthy life by understanding the language and signals of your own body and correcting the lifestyle accordingly, you must know self-science, Atma Shastram. Knowledge, awareness is medicine. Please do not forget to like and share. Thank you.
No medicine can remove the cause of a lifestyle disease, but you can.